Hello, beautiful people. Welcome back to my channel. And if you are new here, I welcome you specially. I'm simply Uche. Today, we have a very important and sensitive topic to discuss: depression and infertility. And it's really very sensitive, but I'd like us to delve into this topic. This is a topic affecting many couples in the world. And we're fortunate to have with us a medical professional who is going to shed some light and provide some strategies, some insights on how to cope and how to deal with this issue. He is an experienced family physician with a tertiary healthcare institution here in Nigeria. And please join me in welcoming Dr. John Cumbet to our platform. You're welcome, Doctor.
Thank you, Dr. Anime, and thanks for having me.
Yes. Thank you so much for being here today.
Yeah.
Let's start by addressing the elephant in the room: the emotional toll that infertility can take on individuals and on couples. And can you just briefly explain to us the link between mental health and infertility?
Okay, thank you for that question. It's good to define what infertility is, then we talk about mental health, then we also highlight some of those things that are related, mental health issues that are related to infertility. Infertility is an inability for a couple to achieve pregnancy within 12 months, that is 1 year. And they've been tried, they've done all they can, they've engaged themselves into unprotected sex without any using form of contraceptive and trying hard to get pregnant and are unable to get that pregnancy. It can be primary, that is when you've never been pregnant before. It can be secondary, when you've actually been pregnant, but you're finding it difficult to achieve another pregnancy. Mental health, it has to do with your health, in terms of how you reason, how you relate with people, how you think because of the situation that are around you. Now, infertility has a lot of link with one's mental health. Now, the link is that, in short, the link is, I can say it's a direct link in the sense that once you have infertility and the infertility is getting severe in terms of the duration, then you're more likely to have mental health issues. In short, it's research have been done concerning that. They even put it that people that are struggling with infertility are having a chance of even having mental illness up to about 60%.
Wow.
Yeah, it's that huge, and that is it. So a lot of couples that are going through this, from from the woman and to the man. A lot of times people are making this mistake. It's the woman's issue, so let's just send her to. No. I've seen couples that are dealing with infertility that the man is depressed while his woman is depressed, and there's a lot of chaos in the home. Now, what are the mental issues that are peculiar to people that are having infertility issues? Central among this problem is depression, which is the most commonest among all the mental health challenges that people that are struggling with infertility have. Other ones will include anxiety disorder. Then we have post-traumatic stress disorders also, where patients are beginning to have symptoms because of either they have engaged themselves into reproductive technology issues, that is IVF commonly, and it has failed. You see people having nightmares, dreams, and they begin to behave abnormal because it has failed. So all of these are the mental issues that are commonly related to the patients that are struggling with infertility.
So from what you're saying right now, it is important then to recognize some of the signs that we could have in the context of this mental health, in the context of infertility.
Yeah.
Okay, so could you help us understand what individuals and couples should be looking out for?
Now, like I said, central among them is the depression. I'll start with the signs of depression, which is the commonest. The first thing is there is low mood. You're always on the low side. There's sadness. You're always sad when you're supposed to be happy. When you see people jubilating for issues that have happened to them, you're not jubilating with them, sad. Then second, you become irritable easily. Small things get you angry. There are issues that ordinarily they shouldn't get you angry, you become very angry. Then next thing, excessive sleepiness. You understand? While other people are awake already, you're sleeping. Then low energy, the energy you used to have before, you don't have it anymore. You're not sick per se, but there's this drive that you have. You find it difficult to get out of bed in the morning and the energy is not there. Other things would include insomnia, difficult to initiate sleep and maintain this sleep. You understand? These are also the symptoms. Then other things, there's something they call anhedonia. Anhedonia is loss of interest in previously pleasurable activity. I'm a golfer. I love golfing. Then anytime I see just the stick of golf, I get excited. Then suddenly I lost interest in golfing. There's a problem. I'm a hairdresser. I love making hair for other women, and suddenly I'm losing interest in all of this. Then suicidal ideation is also a sign. You begin to think of suicide. It has reached to that severe state. So those are some of the little signs. For anxiety disorder, you're anxious. Anything you're panting. You have racing heart. Your heart is beating fast. Yes, panic attacks, and those are the times. Then for post-traumatic stress disorders, you have flashback. Anytime you hear about infertility or somebody that is struggling to get a child, it comes to your mind. Then that memory comes to you. You begin to have high breathing. You begin to have blackouts. You begin to think of that thing, and sometimes you even faint and lost consciousness. So those are some of the signs that you see, mental health signs that one can indicate when you're suffering from infertility. Yeah.
Wow, it's really a lot.
Yeah.
Okay, so could you share with us, now that we've heard about the things to look out for, things that helps us to know that, look, this is a sign of a mental health issue going on here. How then can we cope with this? How can we manage our emotional well-being during this difficult time?
Yes. Now, the management of this mental health challenges, I would like to categorize it. Personally, there are things you need to do. Secondly, there are other ones that you need to see the physicians to help you with. Now, let me start with the personal thing. It's everything that one do begins with the mind. Now, everybody has coping mechanisms and how you'll be able to cope up through difficult situations. Now, the first thing I would like to tell the people that are having this challenge, you must learn to admit your problem and talk them out. One of the major challenges that we have with mental issue is the inability for ones to have somebody to voice out those things that are bothering them. You must. You see, I was telling a group of young people sometimes, I said, if you don't have a friend that in the middle of the night you can call and tell, this is what I'm going through, then it means there's a problem. There's a problem. You must have, be it your father, be it your siblings, be it a close person in office or somebody. There must be somebody, your pastor. You understand that you open up and tell him that, you see me like this. I have killed somebody. Please, what do I do about it? You could go this raw and go down to tell the person this is the thing that you've done. Fine. So you must be able to talk it out. You must be able to talk it. In short, couples should find a good level ground in which you'll be able to express yourself freely. Most of the time, this is the ideal, but it's not always the case because we've seen it in couples. We've seen that communication, one of the major problems in marriages today is communication. Poor communication. People cannot express themselves within themselves. They have to take their problem to other external factors, and these are the ones advising them to come and learn how to live with your partner. It ought to not to be so. Marriage is supposed to be something that you'll be able to express yourself at any time in time. So talk it out. Secondly, is you must seek for help. After you've talked it out, and seeking for help involves going to the right people. Now, if you are struggling with infertility and you're going to the pastor, there's a limit in which the pastor can help you in your mental illness. You may seek the help of a doctor, for instance. The doctor will tell you, this is what you need to do, this is it. If it's a primary care physician, he will refer you to the right person that is going to take care of you before all of that. So these are the things. Then coming down to oneself, your mentality you must work on. You must work on. Don't be carried away by what people say. Don't be carried away by what you hear from what people. Believe in yourself. Believe that you're going through moments of little challenge, that you're going to come out of it stronger and better within the period of time that you have. Just have that. Then, of course, whether you're a Muslim or a Christian, you must go back to God. I would like to tell you that, if the issue of mental health has strong link with your spirituality. Yes, prayers works, reading the word, the holy books also work. It has a way of bringing down this anxiety. It has a way of bringing down this depression. Then other help that you can go into, you can go to your pastor, your moms, and all of that. That will also give you some level of help. Then coming to the doctors, you can seek the help of the doctors if you have these symptoms. The doctors will do what we call cognitive behavioral therapy. It's actually a psychological thing in which they will be working on your mind and telling you some of those things not to worry. And before you know, you have sessions. Within those sessions, those mental health issues are going. Then if it's extreme or it needs to be given some drugs, some medications are being given for depressed people. And before what this drug does, it improve your mood and makes you take you from that sudden part to elevate your mood to get you out of that. So those are some of those things that once if it's been put in place, it will get one of the symptoms.
Wow.
Yeah.
Mm. Thank you so much, Dr. Kumbet, for sharing your invaluable insights on this topic.
Yeah.
Infertility is a serious issue, and when compounded with something like depression, it even makes it more severe.
Yeah.
It is essential to seek help, like our doctor has just said, and support when needed. This is the reason for this community where we can, draw from each other and lean on one another's strengths. Remember, you are not alone in this journey. And so it's a wrap for today's video. If you found the information in this video helpful, do help by giving a thumbs up to this video, sharing it to other women and men who need stuff like this. And also, do not forget, if you're not yet subscribed, to subscribe, turn on your notification and put it on all, click all, so that every time that we post, you get notified. And if you have any questions, I'm sure that our doctor will also be in the comment section and he'll be reading our responses. So feel free to put your comments and put your questions down below in the comment section, and we will do our best to give responses. Thank you so very much for watching today's episode. And I thank you so much, Dr. Kumbe, for coming here to talk to us.
You're welcome.
Yes, and as always, I wish you all love, laughter, and endless possibilities. Till I come your way again next week, it is bye.